Well, evidence on the social causes of avoidable ill health had been growing for about 30 years, up until 2008, when the World Health Organisation's Commission on Social Determinants of Health released a report on the action that nations should be taking to prevent avoidable illness. That 2008 WHO report was released and received some moderate attention in Australia, but it didn't receive a response from the government of the day. So a few of us who were interested in action on social determinants realised we'd be more effective together by supporting each other's efforts to have a government response to that WHO report. So out of that came the Social Determinants of Health Alliance. A book was published in 2011 with many leading thinkers on social determinants that I was lucky enough to edit. And it was through that process of talking to experts on social determinants we thought, yes, there is a movement that could come together that today in 2016 has about 70 different organisations part of that alliance. We put effort into raising the case for action with government, and they responded by allowing a Senate inquiry to be established at the end of 2012. It reported in 2013, and sadly again in 2017 there's yet to be a response to that Senate inquiry report. That report's very important because it gave a bipartisan action plan that was endorsed by the Liberal Party, the Greens and the Labor Party. It set out 5 very simple actions that the Australian government could take to implement that WHO action plan of 2008. So we're now saying, as we lead up to the next election in Australia, it might seem a little while away at the moment, that whoever comes to government, be it Labor, Liberal or otherwise coalition, that there should be the implementation of those 5 recommendations of the Senate inquiry from 2013. The Alliance's work remains important until we get the adoption in Australia of the WHO framework. We think the Alliance will still have a very important job to undertake.
Why do you think there's been reluctance in the current government and previous governments to respond to the recommendation?
Government hasn't grasped how easy it is to implement the 5 recommendations of the Senate inquiry. The first recommendation is that we simply count better, that we measure health and social outcomes around Australia and report annually to create a new accountability. That's not hard. It doesn't actually even require new money, but it does require change in existing processes. It requires different portfolios to relate in a whole-of-government sense. So we're under no illusion that implementing a whole-of-government social determinants action plan is not straightforward, but the importance of there being tripartite support of the Greens, Labor and Liberal Party for action on social determinants shouldn't be lost.
You have a picture of a plane on your lapel there, which denotes the fact that you're now CEO of the Royal Flying Doctor Service. I've been flown into remote communities in the past, and it's the pilot who determines how long I can spend with my patient because of the risk of storms around, all that sort of thing. It seems a bit of a far removed service from what determines the health and well-being of people out in remote communities. Do you think there's a disconnect there?
Well, the Flying Doctors exists today as it did almost 90 years ago to overcome barriers in access to healthcare. Access to healthcare is a key determinant of health. The College of Sciences in the United States and the British Academy in the United Kingdom have both said that healthcare access attributes about 20% of a person's overall health outcome. We're overcoming barriers in access to healthcare by making primary healthcare services available in remote areas where there are no other services. So if you like, the Royal Flying Doctor Service origins 90 years ago were in the social determinants. That language wasn't used then, it's the language we use now, and the role of the Flying Doctors remains more important than ever in overcoming barriers in access to health.